What type of cancer do you have? Hello and welcome to today's video. If you're here, it's likely because you or someone you love has been diagnosed with cancer. First of all, I want to say you're not alone. Millions of people around the world are facing similar battles, and understanding your diagnosis is the first step to fighting back. Today, we're going to dive into crucial questions. What type of cancer do I have? We'll explore why knowing about your specific type of cancer is essential for your treatment and prognosis, and we'll break down the science behind how cancers are classified. Let's get started. So, when you are diagnosed with cancer, one of the first things your doctor will tell you is the type of cancer you have. Why does this matter? Well, not all cancers are alike. In fact, there are over 100, some even say there are over 200 types of cancer, and each with its own behavior, treatment options, and outcomes. Knowing your cancer type really helps doctors determine how aggressive the disease is, what treatments will be best for you, most effective for you, and what your prognosis might look like. Let's think of it this way. Imagine you're trying to fix a car and you wouldn't use the same tools for every problem. An engine issue requires different tools rather than a flat tire, for example. The same goes for cancer. Each type has its own characteristics that requires specific treatments. So, how do doctors really figure out what type of cancer you have? Cancers are classified in several ways. Number one, by tissue or organ of origin. This is the most common way cancers are categorized. For example, breast cancer starts in breast tissue, while lung cancers begin in the lung. This classification really helps doctors choose treatments that target specific organs or tissues. The second way they go about this is by identifying the cell type. Cancers can also be classified by the type of cell they originate from. For example, carcinomas. These are the most common and start in the epithelial, which line the organs and the tissues. We also have sarcomas. These originate in the connective tissues, like the bones or the muscles. Then we have lymphomas. These start in the lymphatic system, the drainage system of your body. Now we also have leukemias. These affect blood forming tissues like the bone marrow. Now, the third way doctors really diagnose cancers or present cancers is molecular by the molecular features. Nowadays, advances in genomics have allowed doctors to classify cancers based on molecular makeup, specific genetic mutations, or markers that influence treatment decisions. For example, some breast cancers express high levels of hormone receptor like estrogen or HER2 proteins, which can make them more responsive to specific targeted therapies. Yes, so once doctors know what type of cancer you have, they also assess its grade and its stage. These two factors play a huge role in determining how aggressive your cancer is and what treatment options are best for you. So, first of all, I'll look at tumor grade. The grade really tells us how abnormal the cancer cells look under a microscope. Low grade tumors tend to grow more slowly and behave less aggressively than high grade tumors. For example, grade 1 tumor looks like normal cells and they tend to grow slowly, while grade 3 tumors look more abnormal and may grow and spread faster. Now, the next point is cancer stages. Staging refers to how far the cancer has spread in your body. This usually is expressed as stage 0 through to stage 4. A higher stage usually means that the cancer has spread more extensively. So, for instance, stage 1 cancers are typically localized in one area, while stage 4 cancers are spread throughout the other parts of the body. Now that we understand how cancers are classified by type, by grade, by stage, let's talk about how the doctors figure this out. They figure this out by doing biopsies. A biopsy is one of the most definitive ways of cancer diagnosis. During this procedure, a small sample of the tissue is taken out from the suspected tumor and examined under a microscope. This really allows pathologists to determine not only if it's cancer, but it also determines what type of cancer it is. The next test that is done is imaging tests. So imaging tests like CT scans, MRIs, PET scans, or even ultrasounds can help doctors see where the tumor is located, whether it has spread to other parts of the body. And so it's very important. Now, the next way doctors test to identify the cancer is genetic testing. In some cases, genetic tests may be done on your specific tumor tissue. These tests can identify specific mutations that may make your cancer more likely to respond to specific therapy. This is known as precision medicine. Now, one thing we cannot stress enough is that early diagnosis can save lives. When a cancer is caught early, before the cancer has had the chance to spread, treatment is often very, very successful. For example, almost all women diagnosed with early stage breast cancer survive for at least 5 years after diagnosis. Over 90% of people with early stage bowel cancer survive 5 years or more after diagnosis. This really highlights why regular screenings and paying attention to symptoms are so important and so vital. Once your doctor has determined your type of cancer, along with its grade, along with its stage, they will work with you in creating a personalized treatment plan. And this plan might include surgery, chemotherapy, radiation therapy, immunotherapy, or even newer treatments like targeted based on your tumor-specific genetic profile. But remember, this journey isn't just about medical treatments. It's also about understanding your diagnosis so that you can make informed decisions about your care. I know that receiving a cancer diagnosis can feel overwhelming, but knowledge is power. Understanding what type of cancer you have and what that means for your treatment, you are taking control of your journey towards healing. Thank you for watching this video. If you found this video helpful or inspiring, please give it a thumbs up. Subscribe for more content on navigating life after a cancer diagnosis. Remember, you are not alone in this fight. Stay empowered and stay blessed. Bye for now.